All right. So a couple things. If you have not gone to um, the OneDrive folder where I've shared some information, I have some stuff from spring semester, which is probably the most updated and the most accurate. And that's what I've pulled up right now and kind of going through this kind of general study guide. There is also I just put together like an updated kind of version of the study guide, as well as some additional practice questions and 2 additional practice tests. I did use AI to help generate some of the content. So a couple of things just don't have the same like level of complexity of questions, but they're still good to go through, and they have keys. And I plan to go through them either well, I plan to just go through the practice stuff and then leave it for you to kind of practice, but I'll highlight some of the important things to know for your 230 test. The biggest thing that's new for you this semester is doing some more of the weight-based calculations, the flow rate calculations, where you're going to look for not only milliliters per hour, but also drops per minute. And then there's some heparin questions, but it's nothing that that you haven't sort of solved out already before. But we'll talk about some of those things. So on this study guide, if you didn't get this, or if you haven't looked at this already, like I said, it's on the OneDrive folder. I'll type into the chat my email just in case you do not have access to that. But I know that if you're here and got the information for this review, then on that review is also where I'll post this review on YouTube, and as well as where the shared folder is that you can download all the stuff that's in there, or reference as we go back in there, go back through this. All right. So I'm not going to spend too much time on these things because you already know this. You're in your 3rd semester, you know these things, but you need to know your equivalents, your conversion factors. The reason I put this in red is because 1 teaspoon, 5 ml is not equivalent to 60 drops unless the tubing is 60 drops per ml. Okay, that's why that's there. So in the updated version, I deleted it because you can have 20 drops per mil, 45 drops per mil. It depends on the manufacturer's tubing and the gauge of the tubing. Okay. Couple things, just make sure you know the correct mLs when you're doing the conversions, because I've had students tell me that 4 cups or that a quart was 1,000 milliliters. If you look and you do like a Google search, some will say that that is the strength or the mLs for a quart, but that's not the conversion you're using. You're using 1 quart is 960 ml, so it's not quite 1,000 milliliters, and you're only 40 milliliters off. Probably not a big deal in the context of calculating how much liquid a patient has consumed, but just giving you that heads up. You want to know your basic metric to metric conversions, which traditionally involves just grams, milligrams, micrograms, milliliters, and liters. And occasionally you might see centimeters, inches, things like that. But you also want to be familiar with how you go from kilograms to pounds, and potentially pounds to ounces, but I don't know that you'll have to worry about that too much. Couple things to keep in mind. The liquids, you're going to measure at the full amount. Ice chips are going to be half the volume. So if you have 8 ounces of ice chips, it's 4 ounces because it melts to about half. Jello is considered a liquid, but things like pudding and what's it called, custard, those are more so solids, so they're not liquid. Just like cocktail, chunky fruit cocktail, chunky soup, those things are not those are not predominantly liquid because they have chunks of solids in them. But popsicles, yogurt, or not yogurt, popsicles, ice cream, sorbet, broth, those are all things that are considered liquids. I think you know that at this point, but it's always good to hear it again just as a review. There are always going to be like nuanced things that ATI may have said. And I'm going to be honest with you, I don't know all the ins and outs to tell you, 100% yes or 100% no for all the different types of liquids. All I can do is base it off of my knowledge base of making some of these things. Like I know pudding is like predominantly a powder, and then you add a little bit of milk or water or whatever it calls for. Whereas, Jello is predominantly water with a little bit of powder. So that's kind of how you look at it, is how it's made. And that, I guess that means you have to assume that as someone who's going into the nursing profession, that you know how to make Jello. I don't know how you're supposed to know that it's liquid, but anyways. So there'll be a few questions on there. Now there's some practice questions here. And again, I think you're fairly, usually most students, especially at Boyce, you're really, really good with these, just the basic like 1-2 step oral based meds. And so we can come back to these, but I wanted to focus on some of the more challenging questions going through. What makes something 1 step versus 2 step? 1 step just means you're just going to convert milligrams to milligrams per milliliter. So like in this instance, the order is Tylenol 160 milligrams. You have available 80 milligrams per ml. And then how much you're going to administer, you just take 160 divided by 80, and that gives you your ml. So you would administer 2 milliliters per dose. So that is considered 1 step because you only have to do 1 multiplication. Whereas a 2-step problem involves usually either a conversion. So like, let's say the order is in grams, but the available is in milligrams. So you have to convert grams to milligrams. Or here, what they did is they did a patient's weight. So in order to calculate this, this is also considered a weight-based calculation. We have to account for the patient's weight to find out what their what their order actually is, and it's going to vary based off of the patient's weight, and usually it's for kids. So 73 pounds, you would convert that to kilograms, multiply that number by 3, and then divide by 50, multiply by 2. I know I'm going through that quickly. It's mainly because you've already seen some of these problems, and we'll come back to it, I promise. All right, so let's just go ahead and go down to some of the newer types of questions. And I know if you had me for the review last semester, I pretty much pull from this review as well, because it's a lot of these things are just overlap. And the main reason you're doing this with me is because you just want to make sure you crush it the first time, don't have to take the retake. I understand that 100%. You have a couple of reconstitution questions. Just remember, if it says reconstitution, that means sometimes you have to look at the label to find out what the actual strength or concentration is. The best examples were like this Ansef, and then there's an amoxicillin one. And what I mean is you want to make sure you're paying attention to when to look at the side label over here, and what you're looking for and what you're trying to search for is what the actual concentration is. So here it says 225 milligrams per milliliter. You want to make sure that's the information you use. How you know you're dealing with a reconstitution, because it doesn't necessarily say for the following reconstitution. Sometimes it just gives you an order and an available, and you have to know that it's a reconstituted medication. So a couple things that I always point students to, because I know that you're not always given the units, you're expected to know what units to administer. So like for Ansef, it tells you it's intramuscular, right? So IM, if it's intramuscular, then that means it's going to be injected. And if it's going to be injected, it's going to be mLs. Okay. We, we don't inject powders. We don't inject grams. We don't inject milligrams. We inject milliliters. Okay. So it's the liquid volume, the liquid measure. So that's how you know is sometimes just by paying attention. So if it's IM, SC, IV, those are all liquid-based meds that need to be calculated to the milliliter. If you have something that is a oral-based medication, it could be a tablet, a capsule, but it could also be milliliters. And a lot of times what differentiates that and how you know if it's milliliters or not is a lot of times just by looking at the label. And if the label tells you, 50 milligrams per milliliter, then that's your clue that it's a suspension and it's a liquid and that it is oral based or that you're going to drink it basically, as opposed to the injectables are always going to be milliliters unless it tells you something else. But that's how you would do that. Then the other clue that you're dealing with a reconstitution is that the label will say 500 milligrams, but it won't say per milliliter. And but you're looking for milliliters, and so that's why you need to look for that on the side label. I feel like over the last couple of semesters we've really isolated that down, and I find that more or fewer and fewer students are having a problem with that. But if it is a problem for you, just let me know. We can certainly practice that a little bit more. All right. I always forget that I got to clear up my annotations before I move along. Okay. All right. I know that some of you are going to want to go through some flow rate questions, so we'll definitely hit those in just a second. I just wanted to get to the heparin because that is pretty much the biggest new thing for you. And then we can go back and do anything else with that. So you're going to see this question a couple different ways. So at Allegheny campus, we actually ask students to answer two questions. We ask them to calculate a bolus dose strength and then an infusion rate based off of the heparin protocol. And then this is just like a truncated version of what's known as the heparin protocol. So what the heparin protocol is that it'll tell you to do a couple things. It'll tell you to bolus the patient with heparin 80 units per kilogram body weight. So this is one of those two-step type problems because anytime you see per kilogram, you know that you have to account for the patient's weight in order to calculate it. There are some caveats where you don't have to do that, and sometimes it's just like kind of a tricky question. But for heparin, this is important, and this is for adults. This isn't necessarily just for children in this instance. Think about your typical, heparin protocol patient. You're going to have somebody, potentially an elderly individual who maybe fell, broke their hip, and they're on bed rest, and they're going to be in the hospital for a little bit, or they're going to be basically stationary for a while, and that is a recipe for clotting, and so they might be put on heparin or some sort of blood thinner or anticoagulant in order to help prevent them from throwing clots while they're recovering. And so you want to get this right because you also don't want to have a situation where you cause them to bleed out because they are not clotting enough. And so you're trying to find that that balance. And so that's what the heparin protocol does, is it gives you some things to do and check. If you go to the Allegheny campus folder for 230, you can, I wrote out the entire, well, I should just say I copied and pasted the entire heparin protocol. And you can kind of see what they do. They basically have checks every 6 hours, and then you can build questions from all those different scenarios. But I don't know that you guys do that at your campus or not. All right. So we're gonna use a couple of pieces of information that we've used in previous classes. But I'll also mention that in addition to the bolus, we also have a infusion rate. Unfortunately, they call it a drip rate. So immediately, at least for me, I'm thinking, oh, I got to calculate drops. But that's not what that means. Um, drops just means you're specifically using a tubing that does drops. If you're just doing an IV and it's dripping in, you're technically doing an IV drip. That's not necessarily tubing involved, but I think that's just more nuanced. And it tells you the patient's weight, which is 178 pounds, and you're going to convert that to kilograms. It also gives you some availables. It tells you we have 25,000 units, 250 milliliters, half normal saline available, and then you have a bolus dose of 1,000 units per milliliter. The order repeats what it says up here for the weight-based protocol, 80 units per kilogram, start a drip, and then it asks you 2 questions. So the first question is, calculate a bolus dose strength. Now, your test may just say, calculate a bolus dose strength, and it may not tell you that you're looking for milliliters. But if we're giving a bolus dose and we're talking about a heparin infusion, then it's IV, it's liquid, so it needs to be ml. And if you're calculating an infusion rate, unless they give you a tubing factor, you're going to be looking for ml per hour. Okay, so I'm just kind of giving you some things. Now, the nice thing about this is really the only thing that changes for the heparin protocol is the patient's weight. Once you solve for heparin, the heparin protocol once, you've done it for everything. You just need to follow the steps. I personally use dimensional analysis to kind of show you the steps, but you can certainly simplify it. I can tell you right now that if just off the top of my head, because I've worked through this problem way more times than I'd like to admit to you, but once I know the kilograms, 80.9, what I'm going to do is, if I want to calculate the bolus dose, I'm going to take 80.9, I'm going to multiply times 80 and divide by 1,000, and that's going to be my milliliters. And then to calculate my infusion rate, I'm going to take 80.9 multiplied by 18 divided by 100, and that's going to be my flow rate. So that's like the simple version, but I'm going to show you the long drawn out version because I like you to know where all that information is coming from, so that way you don't have to guess while you're doing these things. So step 1 is you have to convert the patient's weight in pounds to kilograms. I personally will round to nearest tenths. When I do these, I'm assuming that's how you're supposed to do it as well. But if there's any discrepancy on when you should apply rounding, especially when it comes to patient weight, please run that by your instructor and just make sure that you are all on the same page. I'm going to be honest with you, the difference between 80.9 kilograms and 81 kilograms to me seems meaningless, but it might be meaningful to your instructor. So that's why we do that. Or why they do that. Okay. So what I'm going to do is I'm going to start off with the patient's weight, which is 80. I apologize. This is going to be rough with me trying to write these out. 80.9 kilograms. This will be better on Thursday if you're able to attend, because I'll have my connection a little bit better. And what we're going to do is we're going to take that 80.9 and we're going to apply it towards the bolus dose, because that's what we're calculating, of 80 units per kilogram. So I'm just going to write 80 units here. And that's per kilogram. Now, I understand there's probably a delay while I'm doing this anyway, so it's not even much faster than what I normally do, but that's okay. Now, there's a couple ways we can do this. With dimensional analysis, we can actually just keep doing our conversions until we get to what we like. That's what I'm going to do here, just to kind of simplify it for myself, so I'm not writing a bunch of extra things. So with dimensional analysis, remember the goal is just to get to the point where we're in our final unit, which is milliliters. And even if you didn't know that, I told you at the get-go that you're calculating milliliters for these things. So I have kilograms, I have units per kilogram, and I need to know if I can convert units to milliliters. And that's where I have to look at my available. Now I have two availables. I have 25,000 units, 250 milliliters, but half normal saline tells you that's your bag of insulin. Okay. Your insulin bag, your IV bag, I'm sorry, not insulin, heparin, but your IV bag is what you're using for your infusion rate. Okay. What am I going to use for my bolus? I'm going to use the bolus dose strength, and that tells me 1,000 units per milliliter. So what I'm going to do is I'm looking for milliliters, and I'm trying to cancel out units. So that's how I'm going to write this. So I'm going to have 1,000 units down here, 1 milliliter up here. Now, before I do any sort of math, and this is where this is beneficial to write these things out. Before I do any math, I'm just going to cross out the units to make sure I'm left with what I'm looking for. And what am I looking for? I'm looking for milliliters. Okay. Everything's crossed out. So this is why it's helpful to kind of follow this. I know some of you are not fans of using dimensional analysis, but I promise you, if you can get, well, I mean, you're already in third semester, but if you can get this dimensional analysis stuff down, it does pay dividends down the line. You can almost figure out just about anything as long as you know the different conversion numbers. If you know the different conversion numbers, you can pretty much figure out anything. And I have to say, like, in my experience teaching this for the better part of trying to think of what year we're in, 17 years, I've been like working on this stuff with nursing students. There is the pattern is clear that when you work with this stuff and do this dimensional analysis, you can solve just about every single type of problem you encounter. You just have to know how to, move things around. So, but if you're not 100% certain on all this stuff, don't worry about it. Just know that it that is a strategy that you can work on, maybe before spring or before fall. All right. So once I have everything set up there, then I'm just going to plug it into my calculator. 80.9. I'm going to multiply across the top times 80, and I get 6,472, and I'm going to divide by 1,000. And I'm going to get an answer of 6.472. And what I'm going to do is I'm just going to round that to the nearest tenth, and I'm just going to say 6.5 ml. So what can change in this problem? Well, what can change in this problem is the patient's weight. So what I always encourage students to do is, instead of using 178 pounds, use your weight, use, a friend's weight, significant other's weight, your dog's weight, cat's weight. Just use a different weight, and just kind of, then you can just practice the process. And it's always going to be patient's weight in kilograms times 80 divided by 1,000. That's how it always will work for a standard heparin bolus weight-based calculation. For the infusion rate, again, I'm going to use the same patient weight, 80.9. Again, you can change that depending on what it is. Okay. Now, this one's going to look a little bit different, because what we're multiplying by, it tells us to start a drip at 18 units per kilogram per hour. So this is going to be written as 18 and then units, and then kilogram hour. Okay. Now this is going to be important, because we actually want this hour in the denominator. We want this down here, because what are we looking for? We're looking for flow rate. We're looking for infusion rate, milliliters per hour. Don't get hung up on that word drip. It can drip as a milliliter per hour. It can drip in drops per minute as well, but That's not what that is. Now, again, I don't want units in my final answer, so I need to get rid of units and convert it to milliliters, and we do have a way to do that. Now, a number of students will goof this one up, and they'll use the 1 milliliter over 1,000 units. That's not what you want to use. It would be fine if it was the same ratio or relationship, but it is not. So you would want to use your other available, which is the 25,000 units in 250 milliliter half normal saline. So instead of 1, you're going to have 250 here. And then instead of 1,000, you actually are going to have 25,000. Right, yeah, 25,000. Now, before I do anything again, I'm crossing out kilograms, I'm crossing out units, and I'm looking to see what do I have left. I have milliliters, and I have hours. Okay, so if I have milliliters and hours remaining, again, I'm going to take, that's what I'm looking for. So now I'm just going to plug it into my calculator. I'm going to take 80.9 times 18 times 250, because I'm just going to multiply all the way across the top. And then I'm going to get 364,050. Then I'm going to divide by 25,000. And I'm going to get 14.562. So 14.562, we can go ahead and round to 14.6, and that's milliliters per hour. Now, this is where there's some discrepancy. Some instructors would tell you to just round it to the nearest whole, so 15 milliliters per hour. That might be true. I do know you can administer a tenth and a hundredth, and a thousandth of a milliliter. I just don't know if you can do that as an infusion or not. So again, you might want to just clarify that with your instructor, because I don't have clarification on that to tell you that this is the right way or not. Are there any questions on the heparin protocol questions? Thank you. And if there ever are any questions, by all means, you can raise your hand. You can unmute and talk. You could just type into the chat. You could send it to me privately if you don't want, if you're embarrassed to say, I don't know how to do this. I'm perfectly fine with keeping some anonymity and not calling you out. But I want to make sure your questions are answered. So, okay, I'm going to then clear this. And then the next question on it, so these are just some more infusion rate type heparin infusion questions. So you can review some of those. The other thing I wanted to tackle that's a little bit new was something that was like micrograms per kilogram. Give me a second. Yeah, these nitro orders. Well, first of all, before I start to tackle any of those, does anyone want to see any of these, or do you feel pretty good about these? And I just don't want to waste your time if there's any other particular questions you have. If these are pretty straightforward for you, just let me know. Okay. All right, then we'll go ahead and we'll do these here and then see where we're at. All right. So some of these, especially this this version of the review, I did add some extra questions just to kind of add a little extra. I did put together a key. So when you see like just the generic, I think it's the 25 spring Boyce 230 review, and then there's the key. So you can look at the key in case there's anything that I don't get to answer. And then there's also, like I said, there's some additional practice that might be worth your while to look through. Okay, so for this would be considered like a two-step or maybe even a multi-step type question, because there's a couple things going on here. So the order is 60 milligram or micrograms per minute. Your available is 50 milligrams per 250 ml. And then you are looking to calculate an infusion rate in milliliters per hour. So we have to do a couple things. We have to reconcile micrograms and milligrams, minutes and hours. So this becomes a multi-step problem. So this is even beyond two steps. I think it ends up being like 3 or 4. So I'm going to set this one up exactly the same way, using the same process that I did before. And a lot of times, the reason I'm doing this instead of doing it like choppy, and that's just what I call it when I like do one section, answer it, do another section, answer it, is just because it's easier for me to write with my mouse doing that. So I always say you can start this however you like. I know that some people are hung up on how they learned dimensional analysis when they learned it way back when. And there's certain strategies like putting the ML first and then calculating from there. I just like to always start with the order and then just work from there, but it's completely up to you. So I am going to start with the order. I'm going to take my 60 micrograms per minute. And I'm going to do some converting because I really don't have a direct connection to my milligrams per milliliter or even my hours unless I do some converting. So the first thing I think I'm going to do is I'm just going to convert minutes to hours. So that's 60 minutes in an hour. Then, and I could just set that equal, but like I said, I'm not going to. I'm just going to make a long dimensional analysis setup. Now, I either need to convert milligrams to micrograms, micrograms to milligrams, but since I'm already in this like conversion cycle, I'm just going to go ahead and convert it here. So I have micrograms, and I'm going to convert to milligrams. You already know that 1 milligram is equivalent to 1,000 micrograms. Then, once I've done that, now just if there's no rules on this, but you can go through and eliminate things to kind of see where you are. So once I crossed out the remaining units, what I'm left in is milligrams per hour. Okay, so I haven't done any math yet. I'm just setting the thing up, and I know it's time consuming, but in reality, it doesn't take that long. So I'm in milligrams per hour, and I don't want milligrams, I want milliliters per hour. And so I have a way to convert. I can put now 50 milligrams here. That'll get rid of my milligrams. And then what goes with that 50 milligrams? That 250 ml. And now I'm in what I'm looking for, which is ml per hour. Okay. So we just take our calculator. I take 60 times 60 times 250. And then I'm going to divide by 1,000. And then I'm going to divide again by 50. And I'm going to get a big giant 18 milliliters per hour. And if you think about that, that is super slow. It's going to be dripping out. But that's probably what we want, right? Because if we're using nitroglycerin, it's probably for someone with a heart issue or chest pain or whatever the case may be. And they don't need to be bolus dosing nitroglycerin. They just need it to come in kind of slowly. Let me go ahead and I'll go and let's do a couple flow rate questions because that tends to be the things that students get stuck on. I want to do a drop factor one. There we go. So I'm going to do this gentamicin one. This is actually a good one because there's some extra information here that you don't need in order to answer the question. So it tells us that we have gentamicin, 60 milligrams in 50 milliliters dextrose, 5% water. It's infusing over 15 minutes every 6 hours, gives us a drop factor, and we want to know what the flow rate is. So, couple things. When they just ask you for the flow rate or the infusion rate, typically they're looking for ml per hour. If, however, they give you a drop factor, then most likely they're looking for drops per minute. But we can actually, in this problem, we can solve for both. But my assumption would be that if they give you a drop factor, they want to know drops per minute, not milliliters per hour. Okay. So now, if they tell you drop factor and you see 20, you need to know that that 20 means 20 drops GTT per milliliter, which basically just, or which means for every 20 drops of liquid that comes out of that tube, that's equivalent to 1 milliliter. That's why I was saying, like back at the beginning of the review, when I mentioned that when it said 1 teaspoon was 1 milliliter was 60 drops, that's not that's only true if it's that particular type of tubing, which is considered micro tubing. All right, so you need to know that. The other thing is, when you're calculating a flow rate, you do not need to worry about the strength. Obviously, you need to worry about that from a clinical standpoint, that you're making sure you're giving your patient the correct medication and the correct strength of medication. But when it comes to calculating and they just want to know the rate, we don't really care about what the strength is. We just care about the flow rate. So it doesn't matter. It could be gentamicin, it could be, amoxicillin, it could be Omnistef, it could be any sort of medication at any strength. But if we're calculating flow rate, all we care about is volume over time. Okay. So we have our volume of 50 milliliters, and then we have time. We have 15 minutes, and we also have 6 hours. Okay. So when you see these two times, in order to reconcile what to utilize for this is the 50 milliliters over 15 minutes is what you're looking to focus on. Every 6 hours just means that you're going to repeat it every 6 hours. Okay. So it's kind of like give 2 tablets every 12 hours. You're not worried about giving them 2 tablets, every second. You're worried about 2 tablets now, wait 12 hours, 2 tablets, and then wait 12 hours. This is the same situation. Gentamicin, 50 milliliters over a 15-minute time frame, then 6 hours later, repeat. Okay. So now that we know that, and then we know that we're not using the 60 milligrams and we're not using the 6 hours, now we have everything we need. So let's say I wanted to calculate just the flow rate, okay, in milliliters per hour. All I'm going to do is I'm going to take my 50 ml over my time, 15 minutes. And then I'm going to convert minutes to hours. 60 minutes in an hour. Again, we can cross out minutes and then milliliters per hour. think that ends up being 200, but let me just double check. So 50 times 60 divided by 15, and we get 200. Yeah. So again, I'm just showing you the two ways to get to the same answer. Now, this may be what they want, 200 milliliters per hour, but I don't know that definitively based off of the way the question is written. But like my assumption, like I mentioned before, if they give you a drop factor, then they probably want you to use that drop factor. Okay. Now, drop factor, or when you calculate a drop rate, it's actually in drops per minute. So we can actually skip the 60 minutes per hour step when we calculate the drop factor. So what I'm going to do is I'm going to still use the 50 ml for 15 minutes, but instead of converting that to hour, I'm just going to multiply by the drop factor. Just 20 drops per milliliter. So we're going to cancel out milliliters. We're left in drops per minute, which is exactly what we're looking for. And we're going to take 50 times 20 divided by 15. And I'm going to get 66.666666 repeating. We can't give someone a partial drop, so we're just going to say 67 drops per minute. Now, in reality, you may not be able to give somebody 67 drops, so you might have to choose between 65 and 70. But for the test, you're just going to round it to the nearest whole number because that's what you've been taught how to do, at least from the dosage calc math standpoint. So okay. All right. So just going back to a couple things. Remember with your sliding scale, you're just paying attention to the number. So if the blood glucose is 245, you're going to find the range that 245 exists. So for this one, it's 4 units. So just don't mess that one up. Unfortunately, that's something that gets messed up. Even though it's super easy, right? But a lot of times I think you're so used to doing something with like math that you mess it up. The other thing is insulin is measured in units, so you don't convert units to milliliters. Even if there's a picture of a vial telling you that it's 100 units per milliliter for the insulin, insulin's measured in units, not in milliliters. Let's see here. And those are the main things that are like I said, new, different, or at least maybe adds an additional challenge, particularly those heparin questions. And there's a bunch on here. Um, so I'll just say like we have like 10 more minutes. If you have any specific questions or anything that you'd like to take a look at, just let me know. If you're feeling pretty good about this and just wanted to kind of just hear what I have to say, that's what I had to say. But we have 10 more minutes. So if there's any other question types that you'd like to look at, just put it in the chat or unmute, let me know. Otherwise, yeah, I'll just leave it at that.
Thank you.
You're welcome.